We have reported PROBASE continuously over the last years. PROBASE has started in 2014, so now we oversee 10 years of accrual. The PROBASE study was finished, or the accrual was finished in 2019, so the last participant has now more than 5 years follow-up. And from these data, we can report interesting findings. I think one of the most important findings is that if you have a baseline PSA at age 45 that is very low, that means below 1.5 nanogram per ml, that you don't need any further investigation or retesting for the next 5 years. And as in many other countries, in Germany, it is recommended to test your PSA yearly or to go to an early detection investigation or visit to a GP or urologist every year. And this causes a lot of problems, costs, overdiagnosis, overtreatment. And this is one of the major findings in the last years from PROBASE, that we could prove that at least for 5 years, you don't need any further testing, only with one lab value. And then we are now working on further refining the group that needs screening, as opposed to the group that should not be investigated frequently. And we found out in the latest analysis, and this is what I will report, that, for example, men that have been biopsied once with a negative finding, and this is 60% of the primary biopsies, they actually don't face a risk of developing prostate cancer the next at least 5 years, hopefully and probably 10 years. So this is another low risk group. Another very important and easy finding is you need to duplicate the PSA value. So if you only take one value, you are facing a lot of prostatitis and clinical indolent infections that cause a temporary rise in PSA. So if you control this PSA value within 3 months, then you can reduce this high-risk group that would need diagnosis by half. And that is also a very interesting finding. Most of the screening studies do not have a confirmed PSA before they start diagnosis. They just start diagnosis with a higher PSA above 3. And this is one of the findings from PROBASE, that you really need to control this value. And there are further other groups that really may be reconsidered in terms of risk category. So we are currently enlarging the low risk group that does not need to be tested so often for the next 10 years. Like in coloscopy, where you have a coloscopy for colorectal cancer and you don't need another coloscopy for 10 years. I think the same story will be true for prostate cancer. And that is the main finding of PROBASE.